You speak from heaven, we call it thunder. You are amazing. You smile from heaven, we call it rainbow. You are amazing. And you look from heaven, we call it sunshine. That's amazing. And you made me in your likeness, super amazing. You are amazing, God.
As introduced, my name is Emmanuel. I'm a urologist and I work with Lagos University Hospital. I'll stand on existing protocol. I'll thank the convener, Dr. Onobanjo, for convening such a great event. Oftentimes in the kingdom, it appears we bury our heads in the sand like the ostrich. We don't want to talk about medicine. I'm sure some of in fact, my teacher is here, Professor Bankole. Thank you. Welcome, sir. Some of the previous speakers would have told you how, maybe I wasn't here for their talk, but one of the things we doctors experience in church is somehow we feel ostracized. We feel like we are not working with God. Yes, especially when testimonies go on. It's, God has shamed the doctor, you know. Yes. Well, so it's a thin line for us. We have to speak science and we speak faith at the same time. Sometimes we've made it seem like science and faith contravene each other, but really medicine, the knowledge itself came from God, and God will not do for us what we can do for ourselves. That being said, I'm going to discuss prostate. I'll try not to be too academic. I want to speak more of myths and facts. With the availability of information on the internet, there are a lot of myths that are being spread. They go viral, so many things, and somewhere along the line, the facts are buried and people are misinformed. So I will speak about some of the myths and the facts to that. Next slide, please. Yeah, these are the things or the topics of interest. I want to discuss what is the prostate, how is it important to us, diseases that can occur in the prostate, what can we do to either prevent or early diagnosis, and what myths exist. Next slide. So if you look at the diagram above, unfortunately I don't have a pointer, but the bladder is right in front. That's only men have prostates. Maybe I should start with that. Only men have prostate. It's part of the male accessory reproductive organ. It helps men to have children. It's located just below the bladder. So the tube that brings urine out from the bladder of a man passes through that prostate before coming out. And that tube is a conduit for both urine and, in men, seminal fluid. 30% of that seminal fluid comes from the prostate. You can imagine it as fish in water. So the water comes from the prostate and the seminal vesicle. So without a well-developed prostate, a man cannot have children. So it's quite important. And that's the way it looks from the side. And the other diagram is when you're looking at it from the front. Next slide. Okay, I think I've said most of what's on this slide. Yeah, so next slide. Yes, so it contributes 30% of the total semen volume. It contracts during ejaculation so that semen does not go back into the bladder, and then allows semen to come out at top speed. It also helps with hormone metabolism in men. Next slide. So what diseases can occur in the prostate? There are three major diseases actually. Then it's not restricted or limited to these three diseases, but these are the three diseases of public health interest. There's inflammation of the prostate, which is prostatitis, and then the prostate enlarges as men age. Once you cross that Rubicon of 40 years, the prostate starts to enlarge. And when the prostate enlarges without any malignancy or cancer cells within it, we say that's benign prostate enlargement. And then the topic of cancer of the prostate. So that's the most important, well, not the, one of the most important diseases of the prostate. Next slide. So prostatitis is just inflammation of the prostate. It can be acute, it can be chronic. Yesterday I told the client he had chronic prostatitis and his blood pressure went up. And I had to explain to him that chronic doesn't mean it is severe, doesn't mean it is very bad. You know, there's a lot of, no acute gone, no chronic gone. You know, those definitions are just English words. Acute, it's just the length of time. If it's something that's happened for a short period, we say it's acute. If it's something that's happened for a longer period of time, and there are different definitions of what we call long for different diseases. So for chronic prostatitis, acute prostatitis is about time. Acute prostatitis usually is just infection in the prostate, and it causes pain. The patient will, most of the symptoms of prostate are similar. Patient will pass urine more frequently, will feel pain, and some of these patients may have high temperature and may notice some discharge from their urethra, right? So it can be acute, it can be chronic. Chronic usually is not, the symptoms are a bit milder, but in fact it's more difficult to treat. You treat for a longer period of time. And both are very treatable and curable, and often occurs in the younger age group from about 25 to 45 years of age. So prostate disease is not only limited to the elderly men. Next slide. Again, enlarged prostate. Usually, like I said, as men grow, as long as your testes have been intact and you have crossed the age of 40, the prostate is going to enlarge. The rate is going to enlarge in one man will be different from the other. So you may find a man who is 50 and he still has a normal sized prostate. Yet you can find a man who is 45 and the prostate has doubled in size. So the rates differ. It's like, you can liken it to gray hair. Some stories I heard said someone like Wole Soyinka said having gray hair at about maybe 40, while you'll find some wonderful elderly men seated here and they don't even have gray hair at all. But the truth is, as long as you live old enough, you're going to have some gray hair at some point. So if you live old enough, your prostate is going to enlarge at some point. So it's not just the enlargement of the prostate. The question is the prostate causing problems with urination? And I think that's where we have to get it right. Most times a lot of people will go for a routine check. They'll find that, they'll say, sir, your prostate is enlarged. And then he calls the urologist. I tell him, I can't see you this week. I'll see you next week. When I see the client, he tells you, the last 1 week has been hell. They said I have enlarged prostate. I said, sir, calm down. You have gray hair too. He said, but that one doesn't cause problem. I said, maybe your enlarged prostate is also not causing any problem. Don't let the anticipation of death be worse than death itself. So the question is, the symptoms that come with an enlarged prostate are actually not directly proportional to the size of the prostate. So it's not like, my prostate is bigger than yours, so my problem is bigger than yours. It's not like that. It's a combination of some dynamic components, some static components, the configuration of the enlargement and things like that. So you could find a man who has a normal prostate, we say is about 18 to 25. We extend it to 30 on ultrasound. And you may find a man with prostate of about 35 grams, 40 grams, and he's unable to void urine. And you may also find another man with prostate gland of 80 grams, 100 grams, and he actually can use his urine to join the firefighters and quench fire with his urine. So it's not about, oh, how can I even stop the prostate from getting bigger? The question is, how do you have symptoms, and how can you alleviate, or how can we treat and resolve your symptoms? So the prostate may make it difficult for a man to urinate, and when the man is unable to urinate at all, it's called urinary retention. If it's painful, we call it acute. If it's not, we call it chronic. Next slide. Yeah, so enlarged prostate oftentimes becomes symptomatic after the age of 50. That's what the statistics said before. But things are changing quite rapidly. I'm sure my senior colleagues on my right will notice that they're beginning to see different diseases that used to be said to be of the elderly are beginning to occur in much younger age groups. Probably diet, lifestyle, exposure to radiations, I'm not sure, but things are really changing. So it's important to know that you can actually have an enlarged symptomatic prostate even before the age of 50. But commonly, yes, at the age of 50. This is what the normal prostate will look like. You can see how nice and smooth that tube from the bladder goes down. And if you look at the other side, when it significantly enlarged, that tube seems to have narrowed, and the patient may strain and struggle to pass urine. I'll just let that slide sink in a bit before we move to the next slide. All right, next slide. So what are the symptoms of an enlarged prostate? First, it can be asymptomatic, no symptoms at all. But then when symptoms occur, patients may experience frequent urination. They tend to go to void more frequently than they used to. You find someone who is sitting in a meeting, and a meeting of 1 hour, he has excused himself 2-3 times to go and void urine. They may wake up several times at night. This is usually one of the symptoms that brings patients to the hospital. And some people, once they wake up, they can't even go back to bed. Then some may have this uncontrollable urge to void urine. Once you feels like passing urine, he can't hold it. Even if he's in the middle of, if he does, he has this feeling that if I don't go now, I'm going to actually have an accidental discharge. Using the language from the police, he's going to have an accidental discharge. So that's urgency. And then some will actually have that accidental discharge. Before he gets to the restroom, his pants are wet. So those symptoms occur. And then sometimes they get to the restroom, they've unzipped, they're about to void, and they have to wait 10 minutes for the urine to start coming. They are waiting. The PA is knocking, sir, is everything all right? And then when the urine starts to come out, it comes out in a weak stream. It's just dropping. Just drops. And, it's just like a car. If you drive at 20 kilometers per hour and someone else is at 100 kilometers per hour, you know who will get there first. So he's going to keep dropping, or the stream is weak. Sometimes they have to force to see if the urine can come out better. And then because the urine is not flowing as it should, it starts to have recurrent infection. They may have recurrent infection. They may develop stone in the bladder. Urine may begin to accumulate in the bladder all the way to the kidney. There was a slide last speaker showed, he said obstructive uropathy as one of the causes of hypertension. This can lead to obstructive uropathy, obstructive nephropathy. The kidneys will shut down and even become and have kidney failure. So it's important to get this treated. Next slide. Yes, so I've discussed most of these symptoms. Next slide. Yes, prostate cancer. Let me start by saying that 1 out of every 8 adult male will develop prostate cancer in their lifetime. that is a significant figure. And this figure actually gets more significant as the figure goes up as the men actually age. In fact, they said 1 in 2 men above the age of 80 and 90 will have prostate cancer. So the incidence is quite significant. It's quite significant. On the average, the diagnosis happens at about the age of 66 from studies that have been done. But the question is, we're trying to pick this disease before the patient starts having symptoms, before the disease is no longer curable. So even if the diagnosis is at 66, we hope to start screening much earlier. Much earlier. So it said the American Cancer Society states that people should choose to get a prostate screening based on their age and risk factors. And they should also be aware that this PSA testing or the screening testing is not without its own risk. Next slide. So what are the risk factors for prostate cancer? I listed these few on top. Usually when we talk about risk factors, we talk about modifiable and non-modifiable. Modifiable meaning these are things you can do something about. If you are overweight, you can lose weight. If you live a sedentary life, you can begin to exercise. If you smoke, you can stop smoking. Those are modifiable risk factors for many diseases. Unfortunately, prostate cancer doesn't have many modifiable risk factors. Most of its risk factors are things you really can't change. The first risk factor is gender. Like I said, only men have prostates. So only men have the risk of prostate cancer. And you can't change being a man. God has defined you as a man. Whatever any doctor does with drugs or operation doesn't change whether you're a man or not. Let's be honest with that. So you can, those outside this kingdom will say, oh, I don't identify as a man. I want to be called he, them, we, whatever. Your prostate doesn't listen to what you're saying. So being a man, the risk is there. Now, age. As the man ages, the risk increases. So once the man gets to about the age of 40, 45, the risk is increasing. And by the time the man is about 65, the risk is quite high. So as the man ages, the risk increases. Then another risk factor is race. It's been found that the black race, we blacks, have more prostate cancer, develop more prostate cancer than other races. Most likely there's a gene that we're looking at. We're looking at our androgen receptors. We've not been able to completely explain why, but it's just what has been found. So blacks have a higher risk. The next risk is the Hispanics, the Spanish, Latinos. Then the next risk is the Caucasians, the whites. And the Asians, especially the Japanese, Chinese, seem to have the least risk. Again, even if you use the toning cream, as said by the last speaker, and you look white, you are still not white. Your risk factor remains. You are a black man. Then family history. If you have a first-degree family member, a father, a brother, an uncle who has had prostate cancer, especially those who the person was diagnosed earlier, before the age of 65, there's a chance that you have a higher risk than the general population. Risk does not say that it's automatic. Once your father has it, you must have it. It's not so. Even inheritance. Many people have not been able to collect their father's inheritance. So it's not a done deal, but it just tells you to be more careful. So these are the risks, really. These are the established risk factors. There are some other things that are said that are not so universally accepted, so I won't bore us with that. So these are the risk factors, and you can't change this. So you see, unlike other diseases, I can say, oh, go and exercise, go and stop smoking, go and... All those are good for health. But that it will reduce your risk of prostate cancer, that's not true. So what do we do? Next slide. Yes, again, prostate cancer, like enlarged prostate, can be asymptomatic. The clients will come and you say, oh, sir, your PSA is 40. I need to check further. I say, but I have no symptoms. I'm doing fine. I don't have any problem. I'm doing very well. That's the point where you want to actually find the disease. That's the point where you can cure the disease. So, enlarged prostate cancer, they can coexist and have similar symptoms of weak urination, frequent urination, and things like that. And patients can begin to have blood in urine. And when this cancer spreads from the prostate, the man may experience weak erection, may have low back pain, waist pain, have difficulty walking, begin to lose weight, have yellowness of the eyes. At that stage, the disease is actually quite advanced. It's still quite treatable, but might not be curable. On the lower part of this slide, you will see a test called prostate-specific antigen. It's a blood test used for screening, and it's a very good test. Digital rectal examination is where one of the examinations that both the urologist and the patients do not like, but the urologist has to put his finger in the back passage of the man to feel the prostate and tell whether there are signs that suggest cancer or not. Next slide. Yes, so digital rectal examination. Then prostate-specific antigen. That's a blood test that helps us to assess the risk that we're going to find cancer in the prostate. The normal values are from 0 to 4. Anything above 4, you need to see the urologist. A proper evaluation of your prostate needs to be done. There are other tests we may do. A prostate biopsy. In this case, you will take small samples of the prostate, representative samples from different parts of the prostate. The pathologist will look at it under a microscope and tell conclusively, are there cancer cells in this prostate or are there no cancer cells in the prostate? A PSA above 4 is not a diagnosis of prostate cancer. An enlarged prostate can elaborate more prostates, more PSA. I've always thought, described it that a big man should be able to give you big money. So the bigger your prostate, the more the PSA. Unfortunately, it doesn't seem like the big men give the big money anymore. So prostate ultrasound to look at the character of the prostate, and we may do a prostate MRI to further evaluate that prostate. Next slide. Yes, so this is just Mike was at a family event with his family, and then there were a lot of he was going to pee frequently, and the wives were discussing it. Next slide. Yes, lifestyle modification, very good. Exercise, hydrate, maintain health, smoking, those are good for health. They don't prevent the prostate cancer, but they make you healthy, such that if a patient develops prostate cancer, he's healthy enough to receive curative treatment and be cured of the disease. But the most important thing is to know your risk and get tested. What do I mean, know your risk? Remember the risk factors. You're a black man, so you know your risk. What's your age? 25, your risk is almost non-existent. But once you're 40, your risk begins to increase. If you also have a father or a brother who's been diagnosed with prostate cancer, you should know your risk. And why do you need to know your risk? For black men, we advise that at the age of 45, you start to screen. At the age of 45. If you're beyond 45 here and you've not started, you're already starting late. So 45. However, if you have a family member, a father or a brother who has prostate cancer, it is ideal you start to screen at 40, not 45. That's the ideal age to start screening. And what's the benefit of screening? You want to pick the disease at the point you can still cure the disease. That's the benefit of screening. So please know your numbers. Next slide. Yes, so what are the myths? I'll just run through this quite quickly. Size matters. Like I said, some people, oh, the prostate is so big. The prostate is so big. How can I reduce and shrink this prostate? Size is not all that matters. What matters is the symptoms that the prostate is giving or causing, and is there the presence of cancer cells in the prostate. You can have a prostate as big as my head. If you are passing urine freely and your PSA is low, there are no signs of cancer, we will not even give you paracetamol. So it's not about the size of the prostate. So size, because you go online, you'll find a lot of drugs, a lot of unorthodox drugs talking about shrink your prostate, shrink your prostate. It's not necessary. Next slide. Yes, only older men need to worry about prostate problems. Again, I'm sure from the presentation you can see that not only older men need to think about prostate. Once you're 45 or 40, if you have a family member, you need to start thinking of your prostate. You need to start thinking of your prostate. Next slide. An enlarged prostate always means cancer. That's another myth. That's not true. And that's why many people are afraid. There's no clear-cut understanding that an enlarged prostate is completely different from prostate cancer. In fact, a patient can have a normal-sized prostate and it contains cancer. And somebody else has a very large prostate and it doesn't contain cancer. So don't get too anxious or apprehensive if you do an ultrasound scan and they say your prostate is enlarged. It doesn't mean you have prostate cancer. It just means you need to see the urologist for the evaluation to confirm whatever is going on. Next slide. Prostate cancer is always fatal. Prostate cancer is a death sentence. That's another myth. You find clients will come to the hospital. Once you tell them it's prostate cancer, they say, well, I'm going to die, so what's the need of treatment? Prostate cancer is one of those cancers that can be cured if found early. It's one of the cancers that can be cured if found early. And also, even when the patients come with an advanced disease, it's one of the cancers that can be treated and the patient has some lease of life. Patients will improve in quality of life and even quantity and the number of years the patient will have. You understand? Yes, advanced cancers are always difficult to treat, but it's still treatable. However, the goal is, can we cure this person? And to cure, we need to pick the disease up at the early stage. Hence, again, I'm stressing the need for screening. Let's prevent or let's stop preventable deaths. Next slide. Yes, I'll spend a little time on this because I'm sure this is a very interesting topic. Interesting myth for most men. You would have found it online, you would have seen videos that talk about once you are ejaculating regularly, you don't have the risk of prostate cancer. You know, I've seen it several places. Patients and family members have forwarded videos to me where some people even advise that the amount of ejaculation you need, your wife cannot cope. So get one or two, you know, there's a lot of talk on this, you know, and unfortunately some people who even actually claim to be specialists and claim to be experienced with this are saying this, and this is not true. It's not true. For real. Ejaculation is very good for prostate health. Ejaculation is very good for health generally. In fact, studies say that men who have regular sexual intercourse are not likely to die from a myocardial infarction. And women even who have sex regularly are not likely to even have a myocardial infarction. So ejaculation is very good for the prostate. There's a study which everybody has misinterpreted. There's a study done in Harvard which shows that men who can ejaculate about 25 times a month would reduce, not eliminate, reduce their risk of prostate cancer by 25%. And just 25%. There's the 75% left. So by ejaculating 25 times or 21 times a month does not mean your risk is completely gone. You don't need to screen. You don't need to, and then not sure how many men can actually achieve that 25 times a month right now. Maybe when you were 18, 25. At this age now, I hope you will not try the 25 and in a bid not to die from prostate cancer, you die from something else. So it doesn't actually completely eliminate the risk. And this is one study. And it's done in the best university in the world, so we can't just completely discountenance it. But we have to interpret it with caution. Further studies need to be done to assess this, because no study has actually proven that celibate men have a higher risk. So even men who don't even have sex at all, no study has shown that they even have a higher risk than men who are having less than 21 ejaculations. And it is clearly stated in that study. It's about 21 to 25 ejaculations. It's all or none. If you are doing 10 and you are doing, somebody else is doing 18, Kosiato. In fact, if you are doing 20 and I'm doing 19, until we hit that 25 or 21, there's no... So it's quite a, and it's a self-reported study. I mean, you don't follow people to their house to know exactly what they do. So the person just reports, this is what I do. So, and men have been known to embellish, So, next slide. Okay. Again, I've said this, high PSA means prostate cancer. No, high prostate doesn't mean prostate cancer. Next slide. Prostate, okay, I'll spend a little time here and then stop. Prostate cancer cannot be properly diagnosed or adequately treated or managed in Nigeria. I want to stress this. I want to stress this. Prostate cancer can be accurately, appropriately diagnosed in Nigeria. It can be accurately and appropriately managed in Nigeria. Almost every option of treatment for prostate cancer exists in Nigeria, is available, accessible. I will not use the word affordable, but it's available and accessible in Nigeria. Whatever form you are asking, anyone you need to travel to wherever to do is available. In fact, let me narrow it down. It's available in Lagos. It's available in Lagos. So it can be adequately and accurately diagnosed and managed and treated in Nigeria. So very important. You don't have to think, oh, I need to run out of this country to get treated. I need to run out of this country to get diagnosed. No. The problem is most people come late, and because they have come late and they've been offered treatment that is not curative, they think there's something better out there. And oftentimes when they go, they come back, they find that it's still the same thing. So this is very important. I think this is very, very important. Last slide. Yes, so I think the most important thing I just want us to take away is that last point. Consider regular prostate screening from the age of 45. Please do. From the age of 45. Thank you.
You can do better than that. You can do better than that. Thank you so much.